Welcome back to the Morning Play. And take a look at this super cool new technology. It is letting us look closer than ever before at your mouth, teeth, and gums. It is called a dental intraoral camera.
No getting away with not brushing there. All right, most of us know that good oral and dental hygiene helps us prevent things like bad breath, tooth decay, gum disease, but it also has a big connection to our overall health, especially as we age. And this new camera is really helping dentists get a good look at what's going on inside your mouth. Dr. Roberto Monteagudo is with WisconsinSmiles, and he's here with a brand new high-tech reason to smile. We can't get away with anything now.
No, you can't, really. And the thing is that you mentioned that actually it's been around for about 25 years.
Wow.
No way.
Yeah, actually this camera, I bought one of the first intraoral cameras, I think it was back in 1993 or 4. And it was this huge machine with a camera and stuff like that. But over the years, the technology has changed. So, I mean, it used to cost $15,000, $20,000 to get one of these things. You can now get these high-definition cameras for a dental office for about $300.
It's like almost the size of a toothbrush now.
Yeah, pretty much.
Wow.
So, so we have it. We've had it since 1995 or so in the practice, and patient education is extremely important. So one of the things is when I was in dental school, we would give the patient this really big mirror, then give them hold that, and then we put a small mirror in there and have them like, hey, take a look. Yeah, remember that?
Yeah.
So with the intraoral camera, we're able to take high definition pictures, and as you saw in the video, we could show the patient on TV, so they get to see exactly what we're seeing.
Yeah, okay, so we're looking at video of exactly what you can see, which is pretty incredible.
And not only the video, we could take still pictures also.
Oh, that's
so
nice.
It's great for patient education. They could take those pictures home if they need to discuss anything with their family members.
That looks like it needs to be read on.
Yeah, well, and the thing with, we just had a family function and we had some guests over, and one of the people that were there were asking me, I have to have all these fillings redone, but they don't hurt. Well, we don't want them to hurt. If they hurt, if a tooth hurts, now needs a root canal, a crown, and that. And what a filling basically is, it's a sealer. And so as the sealer starts aging and starts separating from the tooth, bacteria gets underneath and starts causing cavities. And cavities really don't hurt unless they're inside the nerve of the tooth. So with the camera, and as you can see on the pictures, we're able to show the patient up close cavities and any issues with their gums.
Are those cavities?
Those are actually cavities, yeah. Those are cavities in the patient's tooth, and they're very hard sometimes to distinguish.
That's a cavity too?
Yeah, that's a cavity also.
The little hole?
The little hole on the bottom, yeah, that's actually a cavity. And more towards the middle, what you'll see basically a little bit of decalcification of the tooth where cavities are starting to come out.
What's up there?
That's actually periodontal and gum disease. That's plaque, tartar. That's a patient, their upper front teeth. Well, not only tobacco, if they don't go to the dentist on a regular basis. Okay, so what you'll see is, especially on the upper, on the back portion of the upper teeth, front teeth, you really can't flip your head and take a look. So that's why the intraoral camera is so valuable at the practice.
Well, and we took a shot of it. What people see on TV is a bunch of cords, but pick it up if you would. And show us. So it's very small. It's like a wand, almost like a thermometer or something like that.
Yeah, exactly. If you look at it, this particular one is called a mouth watch. And what it is basically, it's a camera, it's a wand. It has a camera on this portion here with some lights.
Where the camera is.
Yes.
Turn that toward
let me see if I could turn that.
It's pretty little.
Oh, it's the other way. Okay, all right.
There you go.
Yeah, and so it's very small. And then what you can see here, the lights actually come out of here.
Yeah.
This is connected directly to the computer.
Okay.
And so then we have these sheaths that go over that. So these are all disposable sheets. Every patient gets one. So very easy to disinfect. And like I said, they're great for patient education.
Yeah.
They're really, really good. And then patients get to see this and go like, okay, now I understand why I need certain treatment done.
Why I need those 6-month checkups.
Exactly. And it's like it's like I tell my patients, it's like this a waterproof sealer around a sink, for example. You put it on there, it's meant to keep water out. But with time, it starts shrinking, water gets underneath.
You mean like a filling?
Yeah, well, so a filling, that's what it is. It's a sealer. It seals the inner portion of the tooth. So as it ages, and everything, unfortunately, man-made will age, it starts shrinking, and then water and bacteria get underneath, and that's where you get decay.
Yeah.
And so, like you saw in the pictures, there's a filling, and certain pictures you'll see like a really dark shadow around it. These cameras are really, really good for picking that up, and that's actually another area of decay.
What's the best thing we can do to prevent decay? You know, they were talking about fluoride on the Today Show today. Things like, is it flossing? Is it brushing? Is it using a fluoride toothpaste? Do you have a preference?
You know, it's a combination of all of them, really. You know, brushing, flossing, seeing your dentist on a regular basis. On this show, we've talked about sugary drinks and certain foods and stuff like that tend to cause more cavities. So, again, flossing every day, huge.
And water floss, you're fine with too?
Yeah, I love the water pick. We've talked about that before. It's a great tool. So just, you know, listen to your hygienist, listen to your dentist, okay? You know, see them at least twice a year.
And if you don't have a good one, call Dr. Monteagudo, because right now the first 25 callers are going to receive a free oral health screening session. That's a $125 value. So if you haven't been in, don't worry, he's not going to judge you. He's just going to say, come on in, let me help you. 414-982-3676 to receive that free offer. WisconsinSmiles.com is the website to learn more, but he would love to get you back on track with your dental oral health. Thanks for being here.
Hey, it's always great to be here.
Yeah, I appreciate it.
All right.